So let's start with our midnight census. It was 426. At Bryan, we have now administered 13,829 COVID-19 tests. Our positives are at 1,683, and we have 522 pending. Currently at Bryan Medical Center, we have 5 positive COVID-19 patients inside our walls. 5 of them are from Lancaster County, none of them from other counties at this time. The number on vents remains at 1. Obviously, that's a Lancaster County resident. And of these 5, 1 is in the ICU, 1 is in the PCU, and 3 are in general care. One other thing to mention before Dr. Vandenhul comes up. Yesterday on our call, there was some dialogue amongst the physicians and feedback that they had received on a state call. And it was all on post-COVID patients and the kind of length of stay, extended stay, and the use of resources from these. There's discussion amongst leaders in the state to make sure we're reporting these recovered patients the same way, and we want to make sure that that's clear. And it won't be clear as we work through this, but we'll continue to bring information to you. And one thing that really brought it to our attention, Dr. Antone from the state called and asked if we really only had 4 inpatients. And we, at that time, absolutely only had 4 inpatients COVID positive. There were still inpatients in the hospital requiring extended care. So we're working with the state to figure out how this data can be standardized so as we provide it to you, you guys can really understand what's going on. I'm going to have Dr. Vandenhul come up, and then again we'll go through about 2 pages of advanced questions and anything else you have. The floor is yours.
Hello, I'm Dr. Suzanne Vandenhul. I'm a family physician here in Lincoln, and I've just wanted to say that I'm blessed to be able to work with Bryan Physician Network. It truly is one team, one purpose. With my patients, I know everyone probably heard, there was a company that had a big outbreak of patients that tested positive. And I was sitting there thinking, I know I've got some patients that work at this company, but offhand, I can't remember their names. So I asked our IT analyst, Hillary Behrens, if she could pull that information from our computer. And within an hour, she gave me a list of 15 patients that worked there. So I immediately set my nurse, Clarissa, and my CMA, Pat, to call these patients and see if everyone had been tested, if they had any symptoms, if they had any contact. And we found out that some of them had actually been tested at a different place where their company sent them to. They hadn't heard the results. They didn't speak English as their primary language. They didn't understand what was going on. So we got interpreters. We hunted down their test results. The patients who tested positive, we made sure that they were controlling their symptoms. They were trying to be as healthy as possible. They were isolating. We also, because I'm a family physician, I love what I do, and I get to take care of multi-generations. I have one family where 2 of their family members worked at this company. They tested positive. Some of their children were also my patients, and even their 4-month-old grandchild was my patient. So we made sure that everyone had been tested. Some people in the family had severe symptoms, and then others had no symptoms whatsoever. They didn't understand that it was important for everyone to self-isolate. So we just encouraged that on a daily basis, talking to them, explaining, we don't want to spread this to anyone. We want to control it in the community as much as possible. No, please don't go to the hospital for your sniffles. That's not important enough to warrant an emergency room department visit. We don't want all the people in the ER to be getting this also. So we just made sure to optimize the health of the people to keep them out of the hospital if at all possible. One of the patients had diabetes, high blood pressure, heart disease. She had the worst symptoms, and we were making sure that she was trying to eat healthy, control her diabetes, take supplements like zinc and vitamin C and vitamin D to help. And surprisingly, she was kept out of the hospital. She wasn't one of those that ended up in the ICU or on the ventilator. Now, I also had another patient that had just gotten back from an international trip, and he called with symptoms. We sent him for testing. His testing was negative, but he still had all the symptoms. So nothing is 100%. I wanted to make sure that he was still self-isolating. His two daughters didn't have very bad symptoms, but they got tested and they were positive. So we encouraged him to stay home, take care of his diabetes, to take his vitamins, to eat healthy, and to get tested again. He ended up going through 3 tests that were all negative, but he had a chest x-ray that sounded exactly like COVID-19. So I called a pulmonologist here in town, Dr. John Trapp, and I asked him to take a look at the x-ray. He saw it and he said, "That's COVID-19. I don't care what the tests show. He's got COVID. He needs to be admitted. That's significant pneumonia." So I called the patient and he kept saying, as he was trying to catch his breath talking to me on the phone, that he didn't have it. And I kept trying to convince him. Then I called the hospitalist group here in the hospital and told them, and they willingly agreed to take him. I called the emergency department and they met him at his car. They did not have him come into the emergency room and spread the germs to anyone else there. They had their full protective gear on to minimize spreading it to anyone. Put him in the hospital. He was there for 5 days and got remdesivir and improved dramatically. Now, his wife was thinking that she could go to see him. She had been trying to stay away from him. He had actually been in an apartment, isolated. But with the 3 tests, she thought, well, I can go visit him now. Doesn't have it. Luckily, we convinced her on those daily phone calls to stay away from him because she works at a rehab hospital here in town. And if she would have been exposed to him, she could have exposed the entire rehab hospital. So I think as a family physician, my role is to protect our healthcare workers by keeping these patients from going to the hospital needlessly when their symptoms are minimal. But it's also to protect the rest of the community by preventing the spread to someone who could get a whole another outbreak in another employment that could spread it to people who are not healthy, and that would be much worse. It's always the ones who have all the chronic conditions that end up having much worse symptoms. But even if mild symptoms, they still need to isolate.
We have 3 different tests that are used here at Bryan. The first one is called Cepheid, and it's basically a stat test, meaning we'll get the results as quickly as possible, and those take about 1 to 2 hours. We monitor our allocation. It's determined elsewhere on how many of these a hospital would get that has a lab like ours that can do their own testing. And as of last night, we had 138 of these on hand. And these are, when you absolutely need someone that comes in and you need a result quickly to determine their admission status. The second category of testing is something called Luminex or Aries. And we have 1,070 of those on hand, and those take about 4 to 8 hours turnaround, and those are also done internally. They're done for first responders, police, fire department, healthcare workers, and then also those that are requiring surgery in the next few days or next day. And then the third category, and this is what our drive-through and our walk-up clinic uses, and some of them coming in through other places. They go out to LabCorp, which is a reference laboratory, and they're taking, as we've said before, it depends. Right now, the range that we're counting on is between 3 and 6 days. We have routine or robust testing capability because there's a lot of kits and supplies to do this, but we're really at the mercy of the national conditions. So we've been as low as 2 days on our turnaround time there, and we have been up over a week, and we're now pushing into the 4 to 6 day area for these. And it's because of what's happening in Florida, Texas, Arizona, and California. Many organizations there use the same reference labs, and they are just frankly inundated. really spikes in other parts of the country when people say we are all in this together. It is not just community by community, state by state, but it is, country by country. I think it's a concern, and I think Bryan would, because we wish there was more supplies so we could do things more in-house. And, I think that's going to be particularly important as we have other institutions like public education, private, when kids are going back to school. I don't envy the decisions administrators have to make as we, have this delay in testing. But in the meantime, it's kind of unpleasant that we don't know where and who is determining these allocations. We're doing our best to get to the bottom of it so we can have more Cepheid and Luminex tests and do them in-house.
If they have symptoms, I tell them to self-isolate. If we have a patient who is sent for a test, whether or not they have symptoms, we tell them to isolate. We say, make sure that you're not going to the grocery store, you're not going to the restaurant. You need to stay home from work remotely. I'll write a note for you to work from home as long as you feel up to working. But we don't want to spread these germs to anyone else. If you have a lot of family members at home, make sure that you are staying in your own bedroom, using your own bathroom, not sharing a phone or utensils. Make sure they're all disposable with your own trash bag there in your bedroom to keep away from people as much as possible.
There has been some batch testing even utilized here, and there's some merit to it, but it's only for the process of elimination. Basically, to explain what batch testing is for those that might not know it, they'll put 5 samples in, spin it around and get the reading. And if all 5 come back negative, you're good to go. But if any of those are positive, you have to rerun each 5 individually. So it's kind of a math game. It definitely would not work in a place like Arizona where they're getting a 24% return on positives right now. It would make very little sense to do there. There are some places still doing that, but with our supplies on hand, we're able to manage it where we're not doing a lot of batch testing here. Well, I'd just say Bryan from the beginning, we have been a very strong advocate for more testing. It's important to learn where this is in the community, suppress it, as Dr. Vandenhul is saying, and get, even if it's not Department of Health contact tracing, it's happening in primary care offices too, to educate. So it is really important to know where stuff is at in the community. So we are an advocate for that. That's why we stood up the state's, first drive-through and walk-up clinics. It's that important to us here. Let's see. Well, I guess a little bit more on that. There has been pretty extensive media coverage highlighting some of the logistical accuracy, scheduling, and legal issues with Test Nebraska, Utah, and Iowa. And in some recent comments, I know that I've read in some of your publications, the state officials indicate there's an improvement, but at this time, we're really not utilizing Test Nebraska. We know that some of our patients might be, and that's great. As for coordination, it's agenda items on meetings at the Department of Health, and that's really all I have. Our desire is for more test kits so that we can run our own test, but we are supportive of all testing efforts to increase testing in our community. Geez, I think it's almost semantics. Did that first wave ever go away, or is it just a continuation? Whatever it might be, Lancaster County is seeing an upward trend, as the question indicated. Last week we were at about a 3.1% positivity rate. That was not just tested Bryan, everywhere, and it's now at about 7.1%. For state totals, the last 14-day time period, Douglas County and then Lancaster County are now 1 and 2. And then what our past history has shown us is when there's a peak number of positive results about a month ago, we then had increased hospitalizations, that lag behind that. And, based on what we're seeing, I'm not saying it's going to be a huge spike, but we do expect to see inpatient admissions increase the week of July 13th or the week of July 20th.
And I've actually had patients in my office that have advanced COPD that require oxygen 24/7, and they have been more than willing to wear a mask. It actually doesn't interfere with their breathing whatsoever. In fact, I think if somebody has other healthcare conditions that, especially that weakens their immune system, that puts them at even greater importance of wearing a mask. I do not think that there's any condition that would prevent someone from being able to wear a mask. If for some reason someone has panic attacks or anxiety issues where they feel claustrophobic and can't tolerate a mask, then I would strongly recommend that they keep that person 6 feet away from everyone else and isolate so that they can not have to worry about the need to wear a mask. But if you're going to go out in public or be around anyone else who might be positive that you don't know about, it's best to wear a mask, or who knows, I could be positive and not have symptoms yet, and I don't want to give my germs to anyone else and get someone else sick. So even though I have no symptoms, I do not want to put anyone else at risk. So I'll continue to wear my mask.